have a look at this clinical question. Key things in this question: this patient's pregnant, they're 20 weeks in, so about halfway. It's a healthy pregnancy, young patient, and they've got back pain. And that's impacting the activities of daily living because it's causing, there's some swelling and some stiffness. And you can see that before they were pregnant, they had a history of previous episodes that resolved with naproxen and no allergies. So what's the most appropriate treatment? So the key thing here is that this patient's pregnant. The correct answer is A, paracetamol. Now that was the most popular answer. Of those that didn't pick that, a lot of people picked ibuprofen. That was the second most popular answer. Okay. And actually, a few years ago, a lot of people might have said, well, for a musculoskeletal type pain, generally NSAIDs are better, more effective than paracetamol. And so they might have prescribed ibuprofen. I might have even prescribed it. What was the cutoff when we generally say not to use NSAIDs in pregnancy? Up until the recent update. At what point would we say, it's better to avoid NSAIDs? Generally, once you're well into the last trimester, right? Particularly in the old sort of guidance, it was once you're 28 weeks onwards. But this latest update, has changed that. So historically, NSAIDs were contraindicated 28 weeks onwards. The reason for it is that it's associated with all these risks. So premature closure of the ductus, renal dysfunction in the fetus, prolonging maternal bleeding time, and inhibiting contractions during the labor, making that more challenging and difficult. And so in terms of the drug, really, it's a class effect, any NSAID really, but particularly mentioned ibuprofen, naproxen, diclofenac. But this latest data highlights that actually there's an increased risk when it's used from 20 weeks onwards. And what they found is that specifically prolonged use even from 20 weeks, so that's still in the second trimester rather than the third, isn't it, at 20 weeks, it can cause reduced fluid because of fetal renal dysfunction. And then it can cause constriction of the ductus, which can lead to heart dysfunction. And actually, not only do they recommend that we don't prescribe it from 20 weeks, but we should advise patients don't buy it over the counter. And that if anyone had sort of been given an NSAID for several days or longer, at any point after 20 weeks, we should monitor them for oligohydramnios. Okay, so they might need additional scans to look for fluid levels. Hope you found that helpful. Please do subscribe to the channel, like and share with your colleagues if you'd like more content.